Testicular cancer is relatively uncommon, and it tends to affect young and middle-aged men. That's the same group who's probably least likely to go to the doctor regularly. The Fox Medical team's Beth Galvin here with one Cherokee man's story.
Yeah, and Christine, you know, the average cancer diagnosis for testicular cancer happens at 33, but Charles Farmer was in his 20s, so when he started feeling strange pains, the last thing that he was thinking about was cancer. Charles Farmer of Cherokee County was in his late 20s and newly married when he started feeling like something was off. He loves to dance, but he says he started experiencing pain, sometimes in his groin, sometimes all over, sometimes tenderness in his breasts. And at first he did what young guys often do, nothing.
I felt like it was just something that would go away, or I thought maybe I pulled a muscle or something, and I've felt that pain down there once before, so I just figured it would kind of a thing that would just run its course.
Farmer didn't realize it then, but two of the symptoms he was experiencing, the breast tenderness and pain and infertility, can both be signs of testicular cancer. By the time he felt a mass in one of his testicles and went in to get checked, he and his wife had been trying to get pregnant for some time.
Nothing was happening. I was just going in for like what I thought and considered a general checkup.
Instead, after an ultrasound confirmed a suspicious mass in his testicle, Farmer came to see Dr. Bryce Wyatt at Georgia Urology.
Actually, the day I met him is the day that we ended up doing his surgery.
Because Dr. Wyatt says testicular cancer is typically found in young boys and younger men from age 25 to about 35 who tend to put off coming to the doctor.
It's very oftentimes missed because people are afraid to go, or when they do go, they wait months before they typically show up.
Farmer had already waited a couple of months.
He had some other signs like the breast tenderness and the swelling. Those are concerning to me for potential metastatic spread, meaning the cancer had moved to other places. And I knew that the quicker we got this taken care of, the lower I could reduce that risk of spread. And I felt for him. I wanted to get this done as quickly as possible, so that's what we did.
Within hours of their meeting, Charles Farmer was in surgery to remove his cancerous testicle.
I really started to think, what's the next step? Like, what does this mean for me being able to have kids?
Farmer's cancer had not spread, so he did not need chemotherapy or radiation, and gets regular scans and blood tests to check for a recurrence.
Cancer to me is just a word. There's nothing you can do to change it. It's only what you can do going forward.
And Charles Farmer is now almost 2 years out from his surgery, and the goal is to get him to that critical 5-year mark cancer-free. And Dr. Wyatt recommends that men do a self-exam every month. He says if something feels off, go ahead and get it checked out, because the survival rate for testicular cancer is very, very high, Christine. But again, with every cancer, we talk about early detection, because early detection, catching it early, gives you so many more options. Because his was early, it was cured pretty much with surgery, we think.
And that self-awareness just about our bodies, period. When you just know what you're supposed to feel, what you're not,
Yeah.
They
just
talk
go
about
with
breast
your gut.
exams, right?
Yes. Yes.
All right, good story. All right, thanks.